At the beginning of the pandemic, the hospitals were empty. People were afraid to go to the hospital. They would stay at home, and we would do sudden deaths at people's homes, which is part of our job. But the sad story was always the same, that they'd had chest pain for 2 or 3 days, but they didn't want to go to the hospital because they were so overrun.
So I'm here with a paramedic from the Greater Toronto area, Scarlett Martyn. How are you doing this afternoon, Scarlett?
I'm good. How are you doing?
I'm doing well. We've chatted before. You've told me some crazy stories being a paramedic during lockdowns and everything. If I'm not mistaken, you're back to work now. And are things back to where they were before the pandemic, or are there things that are still hanging around as if we were still under lockdown? Like, are there still policies in place from during COVID?
Oh, yeah. Healthcare continues to be a disaster. One of the big problems is the hospitals have not updated their vaccination policies in Ontario. Most other provinces they have. So that's really exacerbated the nursing shortage, right? You have thousands of nurses that could be able-bodied, ready to return to work, and yet they can't because their facilities are keeping vaccination policies in place. Strangely, these vaccination policies are for the primary 2-dose series. Remember way back with the Delta variant? So, yes.
Right. So the essentially outdated sort of vaccine, right? Where it's like, this was just for the Delta, now we moved on to Omicron. So it's like, why would you even need these old vaccines when the virus has allegedly mutated anyway?
That's right. Yeah.
And you mentioned different facilities. So is it like, a hospital here, a hospital there? Is there like a regulatory body for nurses or paramedics that also impose the vaccine, or is it just kind of all over the place in terms of where the mandates still exist?
Well, that's the confusion. So there's no mandates. There's just hospital policies. So hospitals are free to make their own policies. So they have to make a vaccination policy, but within that policy, they're free to make allowances for unvaccinated workers. They could have them do antigen testing or something that would be in the best interest of staffing and patients.
Right.
But they continue to hold on to these outdated discriminatory vaccination policies while patients continue to suffer.
Crazy. Well, we're going to be talking about this much more this Saturday. I just want to promote the event. It's Speaking Moistly Live. We're going to be talking about the failing healthcare system. Scarlett will be there. Dr. Patrick Phillips will be there. And also Sarah C. from Frontline Nurses. It's going to be an uncensored conversation because it's not going to be on YouTube, but there are still tickets available. You can check that out at canadapoly.com/event. It's going to be in Mississauga. You'll get the exact location once you buy the ticket. It's going to be 6 p.m. April 15th on Saturday. I'm really looking forward to it. But you would hope that the healthcare system would do everything it can to help and protect people and keep them alive, as it were. And it seems as though, especially during the pandemic, and we'll talk a lot more about this on Saturday, but it seems as though they created all this red tape and all these different restrictions and rules that almost were counterintuitive. People were missing surgeries. People were missing treatment. And again, has that still carried over? Is there still a lot of weird extra testing that happens and extra kind of red tape that that paramedics have to work with that are kind of just counterintuitive to actually helping the patient?
A lot of the support systems that were taken, they're slowly getting back into place, but I think this will be long lasting, right? The damages that this has caused. Yeah, I think we're finally seeing an end to some of the arbitrary rules that were put in place. So I feel positive about that.
Well, that's good. I know that with a lot of different corporations, when it came to the vax mandates, some of them use the language suspended. We are going to suspend. We're not stopping the mandates. We're just suspending them for now. Has there been similar language that you've seen in your industry or in your field where these vax mandates are just suspended, as in kind of almost threatening that, they might be back soon?
Yeah, there is definitely that language. Absolutely right. So there's always the hint of, I think they've rescinded, but won't hesitate to implement them in the future.
Yeah, that can't be very comforting, being somebody who is unvaccinated, right? Knowing that it might be next week, next month, who knows? Oh yeah, by the way, you can only keep your job if you take this medical procedure. By the way,
Yes. Yeah. Who thought we'd face that, right?
yeah, it's back. I hope not. But bring us back to some of the worst moments, or the most absurd moments, perhaps, during the pandemic, because I know there's a lot of things you went through. Is there any kind of specific experience that maybe sticks out to you?
As a generalization, yeah, I would say that the narrow focus to protect the entire population from a virus, which a lot had very little risk of succumbing to, just narrowly focusing on that and calling it public health, I always thought was, sadly amusing, because public health is all encompassing, as we know, right? It's your mental health. It's everything. Closing gyms, telling people not to exercise in the name of health, right? I mean, if I said that was an oxymoron, that would be an understatement. I think like the COVID case counters and the COVID death counters ringing on TVs on CNN, and those of us in the front lines were seeing something different, right? We were seeing deaths, but they were deaths of despair, and nobody was talking about them. They didn't get to be on the little ticker counter, right? Because, and I just thought public health, it was certainly unprecedented.
Yeah, absolutely. And on TV, it was just overwhelmed hospitals. Don't go to the hospital. It's packed there. It's overwhelmed. Hospitals are overflowing. And, you invited me to the National Citizens Inquiry, and now a lot of different healthcare professionals are giving their testimony, and some of them are saying, yeah, this was not accurate. The media wasn't really telling the truth here, or at least they were very much exaggerating. Do you have any sort of experiences reflecting that of what you saw?
Yeah, absolutely. At the beginning of the pandemic, the hospitals were empty. I mean, people were afraid to go to the hospital. They would stay at home, and we would do sudden deaths at people's homes, which is part of our job. I can't say that that's an unusual part, but the sad story was always the same, that they'd had chest pain for 2 or 3 days, but they didn't want to go to the hospital because they were so overrun. The truth is we got some downtime in the station, which is really nice. I work in a busy part of Ontario, so it's always a welcome treat when you can hang out with your colleagues and watch a show or something, but not at the expense that the call volumes decreased because people are too terrified to call. That's just absolutely wrong. And if people were on social media, they would also note that at the same time, there was all these TikTok videos, right? And we did them where I work too. And we did them because we had spare time, right? Like, nobody's making TikTok videos anymore, right? I mean, things are call volumes at its normal, but those two things both can't be true, that we're so overwhelmed and we're also having time to do choreographed TikTok videos, right? Like we just need to look at the big picture now and see what it was.
Yeah. You can't be saving lives and pumping out that great choreographed content at the same time. Yeah. That doesn't add up. And what was it like? Did you ever make an effort during this time to tell your higher ups, hey, we are going to people's houses and they have been terrified to come to the hospital or call the hospital because they think it's overwhelmed and they don't want to, catch a virus or whatever. Did you or anyone try to send a message to the higher ups to kind of let them know about this problem?
See, these higher ups would be not in my field, right? They would be public health officials, right? Okay. So that's where everything was filtering down from. I'm a paramedic, so my higher ups would just be the next in line here. But I went to the media, and I was willing to sacrifice my career at that point to speak out against it. And I was told that if I didn't have 10 other on-duty staff that would tell the same story, that it would not have credibility. So, wow. And I've heard that time and time again. Like, well, if this was true, everybody would be saying it. But I can tell you that everybody wasn't saying it, right?
Right. Well, we're going to be saying it and talking all about it this Saturday at Speaking Moistly Live. I'm really looking forward to chatting with you further there, Scarlett. Just for everyone at home, as a reminder, it is happening this Saturday, April 15th, 6 o'clock. Tickets are still available. You can go to canadapoly.com/event. Dr. Patrick Phillips is going to be there, who lost his license as a doctor, and also Sarah C., the founder of Canada's Frontline Nurses. All three of them, with myself and Mark Paralavis, we are going to be having an uncensored conversation about the failures of the healthcare system. Thanks so much for your time today, Scarlett. And I'll see you on Saturday.
Thank you. Look forward to it.